morning, students. Today we are going to be discussing on communicable disease. As you can see on the screen, disease means the illness or disorder of the body and mind. Now let us now move to communicable disease. Now what is communicable disease? Communicable disease are diseases that can be transferred from one person to another. Mode of communicable disease transmission can be through direct contact, infected air droplets, contaminated food and water, or vector including insects. Some communicable diseases are often referred to as infectious disease. Now, what do we mean by infection? Infection is the entry and development of an infectious agent in the tissues of living organisms. Now, how can communicable disease be transmitted from person or from animals to one another, to another person? Now, transmission. There are many ways in which the elements that cause communicable disease are passed on from individual to individual, and some include coming into contact with contaminated food, contaminated water, bodily fluids, or an infected person. Now, in any case, there has been a source of an infection, and identifying this infection can help in a great extent. That is, when you are able to identify the infections, that can help in knowing what else to do. Now, what are the types of communicable disease? We have the Hairbone Disease, Waterborne Disease, Contaminated food disease, and we also have contagious or skin contact disease and animal or insect bite disease. Now we will be taking this one after the other. Now let us start with Hairbone disease. Hairbone disease, there are two main types of Hairbone disease. These are the droplet infection and the dust infection. When we are talking about the droplet infection, we mean that is when the patient coughs, the microbes are easily spread or transmitted by air. Now, in the other aspect, in dust infection, spitting from a patient deposits the microbes in the dust, the saliva dries up and the bacteria forms spores. Now, when this dust is disturbed, the spores are spread in the air and it is breathed in by other people. It causes infection. Now, some common communicable diseases that are being transmitted by airborne are: 1. Whooping cough, flu, tuberculosis, cold, catarrh, and etc. Now, the next one is waterborne disease. There are also two main types of waterborne disease. The first one is the one transmitted by intestinal infection, and the next one is the one by parasites in animals that live in water. Now, common waterborne diseases are cholera, typhoid, amoebic dysentery, and etc. We have another one, which is the contaminated food disease. These diseases are transmitted by flies, dirty hands, or night soil, or crops. Common food diseases are also cholera, dysentery, and typhoid, like that of the waterborne disease. Now we move to the next one, which is the contact disease or contagious disease, or sometimes it is also known as infectious disease. These diseases are spread by skin contact and are called contagious disease. These diseases transmitted this way are ringworm, syphilis, scabies, and etc. Also, certain animals' parasites are transmitted by skin contact. They have fleas, body lice, head lice, ticks, mites, and leashes. All these are contacted by they are all known as contagious disease. Now, the last one, which is the animal bite. Some diseases are caused by animal bite, e.g. rabies, which can be caused by dog bite. That is, when you have been infected, when there's somebody that when we have a dog bite, it is normally known as what? Rabies. And this is also a communicable disease. Now let us look at some of the communicable diseases. Okay, examples of some of the communicable disease which are very common in our area. We have the first one, whooping cough, flu, tuberculosis, yellow fever, cholera, typhoid fever, malaria, ringworm, scabies, dysentery, measles, sleeping sickness, cold, gonorrhea and syphilis. And we also have the recent communicable disease like Ebola, Lassa fever, and the present one now, which is coronavirus. Now, we move to the prevention, how to prevent communicable disease. Now, the first way, how can we prevent communicable disease is by one, wash your hands properly. Sorry, there is a mistake there. Wash your hands properly before eating and after using the toilet. Also, cook your food properly before eating it. That is most especially the pork or beef. Those that are familiar, that normally eat this thing, pigs. Exactly, pigs. Now, the next one is fresh food that are not cooked must be thoroughly washed with clean water. When we are talking about fresh fruits, we are also talking about vegetables also, like this your efo gure, shoko, tete, and etc. You should wash them properly before eating them or before cooking. Also, avoid moving near an infected person. That is, anybody that you see that he or she is coughing or have catarrh, so you should not move near that person so as not to be infected with that disease. Always boil your water where treated water is not available. That is, where we have treated water, you should make sure the water are well boiled. Now, keep your fingers clean and cut short your fingernails. Especially, I will be referring to most of our ladies that they like keeping nails. So you should always keep your fingers short. Also, avoid sharing personal effects with other people like cups, comb, pants, singlet, towel, toothbrush, and others. Treat wounds and sores and never leave them exposed. Yes, you should always make sure your wounds are not exposed, so that you are not going to get contaminated. You will not be contaminated by germs or any other infected organisms. Now, ensure good environmental sanitation both in and outside the house. That is necessary, and that is what you should always ensure you have a good hygiene. Destroy oil vectors. Always eat adequate diet, maintain high personal cleanliness, and fumigate your surroundings regularly. That is also necessary. Regular medical checkup is highly important. And another one is regular vaccination and immunization are essential. That is, you should always immunize yourself. Especially nowadays in Nigeria, we have what is known as the kick out polio and other several immunization programs carried out by our government. So you should always make sure you are also immunized. And the last one, which is isolate any infected person. Anybody you realize that is being infected, you should isolate the person from other people. Maybe in your school, in your mosques, churches, and every other places, or markets also. So you should isolate any infected person. If you can, all this we've read about the prevention are also useful to that of the present coronavirus, in which you should also take caution of. Now let us look at the general control of communicable disease. One, infectious disease often causes epidemics. Therefore, proper care must be taken to contain spread once they are observed. The measures to take include: one, a suspected patient should be isolated. As I explained earlier on, all materials used must be reserved for him. That is, all material used for that infected person must be reserved for that person alone. The room and the clothing must be disinfected always. that is, the room in which the infected person is should also be disinfected, and the clothing he or she is putting on. Only specially trained nurses should care for him or her. Now, people living with him should be observed. That is, those people living with that infected person should also be observed and also be checked regularly, so as in case of any um any infected or any infectious organism. The next one is vaccination and inoculation should be taken to give immunity. And the last one, some of the pathogens can be eliminated through perfect cleanliness. That is, through perfect cleanliness, we can also eliminate some of these pathogens. And remember, what do we mean by pathogens? I explained pathogens in some in the previous class. That is, those virus, the virus and virus, bacteria, ringworms, and etc. So they can be eliminated through what? Perfect cleanliness. Now, other control measures to communicable disease, that is, apart from the general, these are also necessary. Heat can also kill communicable disease. That is, all articles should be sterilized by boiling and heating them properly. Now, cold also. Freezing and extremely cold conditions slow the rate of reproduction down of bacteria. That is, when the weather is extremely cold, it also slow the rate of reproduction. Sunlight also is also necessary. That is, rooms that have good sunlight never encourage bacterial and viral growth of development. We also have fresh air. Rooms should be well ventilated. And the last one, which is what? Antiseptics and germicide. That is, you should make sure you use the use of these antiseptics and germicide can also cure what is known as, can also kill the communicable organisms. Now for today, we are going to be ending our class, and that will be the end of the class for today. Thank you very much.